Hi Kelsey, I'm Stephanie.
Hi, Stephanie.
I'm going to help you with some breathing today. I've been told that you're kind of having a hard time getting some deep breaths. Is that true?
Yeah.
Okay, great. So if I can have you just lay down, we'll work on some of those things to improve that breathing. Okay, perfect. Are you comfortable?
Mm-hmm.
Okay, is your pain level pretty low right now?
Yes.
Okay, great. So what we're going to do is I'm going to teach you a technique called diaphragmatic breathing, and it's utilizing a muscle called your diaphragm, which is a big muscle in inspiration, or when you take that inhale. So what it does is when you inspire or you breathe in, it flattens, and then it comes back up when you expire or breathe out and comes up kind of like a tent. So it's constantly going like this, okay? So first, I'm going to have you feel for your diaphragm. Is it okay if I touch you? Okay. If you can just itch your hands up the front of your ribs, good, where they kind of join right here. Good. Your diaphragm is located just behind the bottom of your ribs there, all right? So what we're going to do first is I want you to kind of feel what the diaphragm feels like when it contracts or when it gets really hard, okay? So what you're going to do is I want you to take a big sniff as if you're like, you know, have something in your nose. So big, okay? Ready? Go ahead. Did you feel something kind of get a little bit harder under there?
Mm-hmm.
Okay, good. That's kind of what we're trying to utilize, because if you can utilize that, you're going to get a lot stronger and you're going to get a lot more powerful breath with less energy, okay? So first I want you to put your hand on your belly here and your other hand up here on your chest. Perfect. So what you're going to do, I'm going to show you here on me first. So what you're going to do is you're going to take that big sniff and then you're going to exhale. So sniff through your nose and exhale through your mouth. So watch my bottom hand, and it should come up when I sniff. So, and then it'll go back down as I exhale, okay? Does that make sense?
Mm-hmm.
Okay, so let's try that. Ready? I'm going to have you breathe in for 3 and out for 6. And sniff, 1, 2, 3, and out. That looked pretty good, but I think we're going to try to get that belly a little bit more involved. So we want your belly to come up, and I want it to come up all the way towards the ceiling. So focus on pushing it out towards the ceiling when you breathe in, okay? So let's try again, and go ahead. Good. 1, 2, 3, and out. 1, 2, 3, 4, 5, 6. You did a lot better that time trying to get that belly up to the ceiling. So let's practice about 4 more times, and we'll just keep doing it. Ready? And sniff. 1, 2, 3, and out. 1, 2, 3, 4, 5, 6. Again. Sniff. 1, 2, 3, and out. 1, 2, 3, 4, 5, 6. And again. Sniff. 1, 2, 3, out. 1, 2, 3, 4, 5, 6. Good, and just sit here and relax for a minute. So how do you think you did? Were there any problems or things that you thought you did well?
I can feel my stomach going up far, but I still feel some top movement.
Okay, so let's try it one more time and really focus on getting that belly out and no movement up here in your upper ribs, okay? So one more time, and sniff. Good, and out. 1, 2, 3, 4, 5, 6. Great. So relax here for a minute. So this is basically all diaphragmatic breathing is. Just take that big sniff and then exhale out. And you want it about a 1 to 2, ratio of sniffing in and exhaling out, okay? So we're going to practice this, we're going to test retention tomorrow, and we're just going to do this again, and I'm not going to give you any cues, and just see how much you learned from today, okay? And then eventually, I want you to practice like transferring this skill. Instead of laying down, I want every time you go to the bathroom, I'll have you stand up and practice that diaphragmatic breathing about 4 times. And then hopefully you should begin to learn it more and more every time you practice, okay? Do you have any questions?
Nope.
Okay, good job.
Thank you.